Patients come to Northern Light Mercy Hospital for a variety of surgeries, including joint replacements, spine surgery, and general surgery, among others. While the surgical services you are receiving may vary, you can expect your care teams to take many of the same steps covered in this video. The process begins before you arrive. All patients will get a call from a nurse who will review medical history and some basic information. While you may have answered some of these questions before, it is part of how we create a safe plan of care for your surgery at Mercy. When you get to the hospital, you can park nearby and walk in, or be dropped off at the main entrance. Wheelchairs are available if you need one. All of our staff are required to wear face masks and other protective equipment for your safety. We also screen everyone who comes into the hospital. You will be pre-screened before you arrive, and again upon entering the hospital. Once you're screened, take the elevators to our second-floor surgery reception. When you get off the elevator, the surgical receptionist will be there to greet you. The Family and Visitor Lounge is next to reception. It's comfortable with great views, and you'll notice we've created plenty of space for distancing. When you check in for surgery on the second floor, we'll show you the surgical tracking board and explain what the colors mean. Throughout your surgery, our staff and the tracking board in the lounge will let the person who brought you to Mercy know about your progress. When we're ready, a nurse will bring you into pre-op. The care team there will introduce themselves, answer your questions, and help you prepare for the rest of the process. While you're in pre-op, your operating room is thoroughly cleaned, sanitized, and prepared for your procedure. When pre-op is completed, the pre-op and operating room teams meet. They work together on your care plan to ensure your safety is always the top priority. When we're ready, we'll bring you to the operating room. There, you'll meet your OR team. They will introduce themselves, answer questions, and ensure you're comfortable before giving you anesthesia. Depending on the procedure, the length of your surgery will vary. When your surgery is complete, you'll be moved to the recovery room, where you'll be monitored to ensure your safety. We let your loved one know when this happens and when they can see you. If you've had an outpatient procedure, you'll be monitored and then sent home after recovery. If you're being admitted after your surgery, we'll move you to your private hospital room. Depending on what you need, you may see a physical or occupational therapist before you go home. Whether you're staying with us or have same-day surgery, our pharmacy will deliver any of your needed medications to you before you leave. A member of your care team will always follow up with you after you leave to check on your progress and answer any questions you might have. To learn more about surgical services at Northern Light Mercy Hospital, please visit mainmaidus.com/mercysurgery for more information.